with you. My bedroom.
Good evening and welcome to the program Bodi Talk. We come to you every Thursday from 5 to 6 o'clock. Inside the program Bodi Talk, we talk about different sick them within the cause and treatment, signs, symptoms, and self-prevention. As always, we can get experts them the program, and today they talk to Dr. Nelly Bell, President, Pediatric Association of Salon and HOD for Pediatrics, Commerce and University of Salon Teaching Hospital Complex. And today inside the program Bodi Talk, they talk about myths in newborn care and Pediatric Association of Sierra Leone and its upcoming conference we then forget. And members say yourself will listen, you get opportunity for call on number 0779819181, 0779819181, and maybe they bring you this edition of the program Musa Kamara Naminim. As I mentioned earlier, today we get Dr. Nelly Bell, President, Pediatric Association of Sierra Leone and HOD for Pediatric Commerce and University of Salon Teaching Hospital Complex. Good evening, Doc, and welcome to the program Bodi Talk.
Good evening.
Yes, you therefore talk about myth in the newborn and myth in newborn care and Pediatric Association of Salon upcoming conference. We can look at the incident day proper, but we just want to remind we listeners them today we not get quiz because last week we not been get fresh edition. We repeat. So from today on, you get for pay attention from this one. As next week, based on what we talk today, we'll go ask Kuna inside we quiz, and if you answer, as always, you get 50,000 leons to pop. I mean, that's not 50 millions to pop. So one for say sorry to we listeners them. I know say plenty of them got already for win prizes them this week, but we sorry we not do program last week as now repeat we been do, and based on that repeat we been do, we don't ask questions, then they people they don't answer and win. So this week we they preserve the couple for next week, and see how we go able for expand them next week, so that more people will win. As usual, now two blanks win, but one make a more win because this week we not do quiz. The program now Bodi Talk, they can say from 98.1 FM, and we bring you this edition. Musa Kamara Naminim. I come to with studio guest winner Dr. Nelly Bell, President, Pediatric Association of Salon and HOD for Pediatric Commerce, University of Salon Teaching Hospital Complex. Doc, when we talk about pediatric, what do we talk about in simple terms?
Yes. Good evening once again, and I'm glad for dinner this program. We'll talk about pediatric. We talk about picking them, and we talk about picking them from when them born until then 18 years of age. So now that's what they talk. We'll say pediatric. So picking them, then a doctor, pediatrician, now doctor where they deal with them picking them from 0 to less than 18 years of age.
Okay, they come up from you get a senior position at this area, so you are the president for the Pediatric Association and also HOD for Pediatric Commerce and University of Salon Teaching Hospital Complex. Look at the role here, so from your own perspective, what's the difference being HOD for Pediatric Commerce and also the HOD for University of Salon Teaching Hospital Complex in the pediatric section?
Okay, from your part, where you talk about training, you talk about undergraduate training and postgraduate training. For the undergraduate training, then are before the degree, before the students, then are medical students, before they get their degree. Then they are commerce, College of Medicine under the University of Sierra Leone, and then they deal with that one day. So me are the head of department for pediatrics, and they deal with the medical students in the 5th year where they come to me. When they talk about the University of Sierra Leone Teaching Hospitals Complex and the Ministry of Health, we they talk about postgraduate training. So that means say after the degree, that means say they want they don't done, then a doctor, and they don't done an internship, then they come for study for become picking doctor then. So that one day on, we thankfully we get accreditation. We call that day we allowed for trained doctor then now in a salon for become picking doctor. First time it not been possible. We get for go overseas for legal study.
We get plenty picking doctors, eh?
Now we they develop them, yes. Because you know, say where they go out for study, it can difficult for let them come back. Now that we they train them inside salon, then they stay, so they develop the numbers there
So
now.
you know they only train them at university, where you train them, when they go work back, then go meet you there.
Indeed, yes.
So how important pediatrician then they?
So how important it is for get pediatrician?
Yes, now the country
Yes.
or the health system.
So what I always say is picking not to small adult. So that means not all doctor they really able for specifically manage picking the way they sick or even the prevention aspect of it. So 50% of the population as alone now, or 45 to 50% now 15 years and below. So we own the one the way we they deal with that the majority of the population as alone. So it's very important for me to get specialized doctor then we're able to manage this kind of population here when are picking them because them they boku na the country and all over the place. That's one. Secondly, then get what they call mortality rate na salon of picking them. That means say almost picking them they die. The mortality rate na salon for picking them under 5s, infants that are below 1, and then neonatal that are below 28 days, newborn, they're high. Now one of the highest in the world. We don't make great improvements over the years, but we need for accelerate we efforts them, and that's make we get this 300 days of activism we presidents don't call for. So we need for accelerate that one day so that we can get zero preventable child death. So that we go can down small bits na the scale because we did too high up in terms of the mortality of picking them. So that are just the two. There are many other reasons them, but for time, then are the two major reasons then why make it important for get picking doctor in a salon.
What's the difference in terms of treating big person and with it speaking?
Yes. Okay. So then I want no lecture why they give.
It's good because
no lecture why they give
because this
yes.
program for raise awareness to we listeners them. We get a very big audience and most of them they learn from this. And as I mentioned earlier just now that we always they get quiz. So we listeners them for today go win something from today lecture we they give so. So it's good that you lecture.
No problem. As I say I want no lecture, that means I 1.5 hour for talk about all the differences between picking them. But I go name a few. What do they call the metabolic rate? So the way how picking them they deal with medication, food, or anything where then they eat or where they give them, it's different from adults them. Okay, if you look at the physiological, so the standard rates of picking them, like respiratory rates, how fast then they blow, is faster than big person. And also in all of this, the neonates that are 0 to 28 days, is different from the infants when are less than 1 year. It's different from the under 5. It's different from the 15 to. So all you get difference in all of them.
So don't look at the difference in the treatment of them.
Yes. So it's not about the treatments. I recognize and say, for instance, so medication then they where the dose is different for picking them than for adults them because the body they metabolize their medication then they differently. Some medication and they way it good for picking them for certain. I don't want to go too deep. Let's talk about meningitis. Okay, if picking gets if baby neonates get meningitis, you can get a certain drug because in brain not that's developed. The brain barrier, that membrane where they between the brain and the rest of the body, not that well developed. So the medication go pass through easily. That means if you get picking and adults inside where you get toxins them, the picking go collapse quicker than the adults because the picking go collect them and then they through the skin, through the how we inhale them to the lungs, it go get them quicker and it go faint quicker than the adults go faint. So when picking faints and you think say there's some kind of toxic things around the atmosphere, you know say no, this one the picking don't faint, so there's something going on. Low we watch. Okay, then you get the food way then they eat. Okay, then they go bring me to like country medicine, so where the people then feel say harmless. No, it's not harmless. The measurements where we know now measurements for big people them.
This is which level we talk about because you mentioned different level than just now. So I wonder we take like from age from 0 to 28 days, the kind treatment where they give them, and how you go even know say this one or well. Would they go with some to where is sick? Look at that, then they will look at under 5 and look at the one them from
So
5
that
to
question
18.
is very broad. That question is very broad. So if we dey talk about 0 to 28 days, then are the neonates them, then are the newborn babies, and we actually we're supposed to talk about today.
Okay.
Okay. So then breastfeeding. Okay, you talk about breastfeeding. 0 to 6 months.
Okay.
You get for breastfeed them. Where them born. As soon as them born, you get for 1 hour after them born, you get for give them breast milk. Talking about the gain stem of breast milk, then they own we'll go there at tomorrow, because there's a lot of things then we breastfeed. Why make people them for breastfeed them babies them, especially that exclusive breastfeeding where they talk about. Okay, so 1 hour after the baby born, you for don't put her to the breast for let it begin for suck. Then they alone go save that baby from so many things, prevents that baby from so many diseases them. Okay, so if you want to talk about specific diseases them like cold, in a neonate.
So in a situation where the mama in Bobino can quick, so that's it.
You don't go another tangent. Okay,
yes. So because some person
Yes.
they born but the Bobino can quick,
Indeed.
and the pikin need food.
yes, so it come that day they happen very often. So that baby don't dey inside you uterus, inside your belly, basically, for so long, most of the time 9 months. Okay, that baby don't use to your body. So that way then can talk say the milk not they come or the milk not fine for the baby, it's not true, it's a myth. So what can happen at that point? The woman is stressed after I don't deliver. It's a very stressful situation for deliver baby. The mother is stressed, okay? Then it possibly dehydrated, okay? So what thing you need for do is make the mama relax, make the mama drink a lot of water, okay? Then you put the baby on for suck. Now you get one mechanism where if the baby not suck, more milk no dey comot. So it's like a vicious cycle. So if you say milk no dey comot, then the baby no dey suck, the message no dey go to the brain for say, brain, send on the message to the breast, let more breast milk produce. I don't know if you understand that scenario there.
Okay.
So the less the baby they suck, the less message they go up to the brain for let the brain send the message to the body for produce more milk. So now, when that milk no dey comot, the baby for the suck. Still, if for suck the baby. And you realize say with that frequent sucking, they stimulate the nipple so that the message go. Water, the mommy for drink boku water, and if for relax.
Is it advisable for give the pikin water?
Yes. So then another myth. Now they come to the topic of today. So then another myth. So then they talk say you forgive picking water. Now, milk, breast milk, it contains a lot of water. So what in me go advise Combra them for doing that one the way they breastfeed, just squeeze the milk, put on a glass, you left them. You go see how it sediments, then you see the amount of water where they inside breast milk. So there is no need for extra water. Not even if the baby they hiccup, if the baby they pass stool. Once na the breast milk you they give, just stick with the breast milk. It has enough water. Then the other thing is, when you give that baby water, the baby in belly small. So if you give her water, they full up the belly. So the space where left for the breast milk is small. And water not get nutrients where the breast milk gets. And all the wonderful things the way breast milk gets, it not get them. So you deprive that baby of all the nutrients the way we forget from the breast milk. So no, it's not advisable for give, especially when they're talking about exclusive breastfeeding. So it's not advisable for give baby water.
In a situation where say the mama and Bobby not come, you say na a real case.
Yes.
Or in a situation where say the mommy born, they lost the mommy, then they enable give the picking Bobby. Is it advisable from 0 to 28 for give them any other food?
Yes.
Like other supplements?
Yes. So other side then gets breast milk bank. We not get an a salon, but hopefully go can soon. Then get breast milk bank. So say we go get breast milk for that baby day. But we not get an a salon. So yes, some instances them there you can relactate, so you can bring back breast milk of the grandmother we go able for breastfeed. But the reality in Sierra Leone is, boy, they happen, no. I don't see it happen before, na salon. But the reality of the fact is, if we've lost the mom, then go get forgive the formula milk. Yes.
But if the mommy did, then the breast milk no dey come out.
No. Now I don't give you the scenario. So make the sure say the mommy rest, it drink a lot of fluids, and you get frequent stimulation of the nipple for let the breast milk come. I guarantee you, I say the breast milk will come.
If you just did tune in the program now, Bodi talking the country from the Society for Radio Democracy 98.1 FM. You just listen to Dr. Nelly Bell, President, Pediatric Association of Salon, and HOD for Pediatrics College of Medicine and Allied Health Sciences, and also University of Salon Teaching Hospital Complex. Today, we will talk about myths in newborn care and Pediatric Association of Sierra Leone and its upcoming conference. So we'll talk about picking well body for now. Later we'll look at our conference and how this conference will able address some of the issues that we'll talk about and how we able raise awareness about some of them here. Apart from what we don't talk to, what are some of the other myths them around picking within just born?
Yeah.
And how for care for picking within just born and how you go able like change the mindset of people about some of the myths that we then been about newborn picking.
Yes, so before we move away from this breastfeeding, you get that fore milk. That it's a yellow and it's thick. Then at the first milk where they come out, now the mommy in breast. So people then can look down and they say, then they not so good milk now for toyam because it's yellow and it's thicker and it's not as white as the regular milk where we know. It's wrong. That first milk day now is very, very healthy because it gets immune globulins, so it gets antibodies there, where go fight against diseases, then can call on the first vaccine of the baby, then call on colostrum. Now so then call that first milk day, not so for discard, now for giddy baby, in need them. It gets a lot of nutrients, and as I say, it gets antibodies, then way go fight against diseases then for that baby day. So that's one myth where we need for move away from. That first milk day, I don't know if you don't ever hear that.
Yes,
first milk.
And some situation like give me say, okay, we're picking up suck baby for long term, you need for wash the baby so before the picking sucker.
Yeah, so hygiene is important.
Okay.
Because we get all kind of different mothers, and so we can teach them for hygiene, infection prevention and control. Okay, but for say the crop the baby, no, not necessarily, because that baby don't dey inside the mama in belly for 9 months, so used to, But that basic hygiene is necessary, definitely necessary. What you don't need for do is that if you're talking about washing, some man then can say for wash the baby the day where it come out, especially if you get that white. We call them vernix, that white substance in body. No, that white substance they nine are the cocoa butter of that baby day, so it actually protects the skin from.
So what I need for do if the pikin and born away white so?
Yeah, so you left them on. Okay, so if you know the smell, okay, because some babies then can born with the amniotic fluid not so healthy. So if you know the smell or anything, if not just the white substance, the vernix, you left them. Now, good protection for the baby in skin, okay? And then you don't necessarily get for wash the baby in the first day. The bookman then say after 24 hours, now you for wait before you actually wash the pikin. And as I say, if you get a scent, then obviously you go need for rub and down. But generally speaking, in the first, after the 24 hours where the baby don't born, now in the advice say maybe you go wipe and down. But you don't need for, even that regularly, where they say every day for wash baby, no. You don't need for wash them every day. Okay, because they rub away all the nutrients in the skin, all the nice things that with the skin they produce.
What about for wash and 2 times per day? Because
No.
if it plays hot, it thinks for wash and 2 times per day.
No, not necessarily.
What thing they cause to pikin?
So the picking in skin, they produce substances that were healthy for the skin. Okay, where they make the skin moist. If you wash and too much, the skin they dry. And then artificial oil they we can put on the picking them. We don't know if it carry bacteria. They have things the way they cause infection. Okay, we don't know if then they go cause them. So if you say they wash and to them, the body go dry. One, and then if it dry, you say you want for put the oil then param. If the oil no clean, not sterile, we know the oil they now where then they sell in the street. Then they go cause the baby for get skin infection, especially with they see now that bumpamine where then they rub. We see quite a number of picking them. And me, I train overseas. Where I come, and they see them skin condition of them babies then at the ward. So I decide for ask questions them. So what thing they cause this skin condition? Behold, now this bumper mine, where then they rub pan the babies then where they born, because they I think say they say they make the skin smooth. They cause infection of the skin. So we don't sit down there and we don't say when we go for the talk say for rub bumper mine and then babies then skin, because it cause infection, because the bumper now gets in bacteria there, we go cause the skin infection now, and it's not good.
So you talk about when in the born picking, it come with white, and the advisable that's not for wash the picking at that moment stay. But is it advisable for rub baby oil pana at that moment?
Yes, so now that's I say, just now baby oil not necessary, because it could cause bacteria. Okay, it's not bad for rub baby oil. If you sure say you not get no bacteria, they will go cause skin infection. Okay, I know they say baby oil bad. You can rub baby oil, but just ensure say you not get the bacteria them, and they do it so often. And if you more often you wash the picking, the more often you get for rub the baby oil.
So in a situation like we mentioned, say the picking they feel hot, you get for the sweat, or then say no low wash some 2 times per day or low wash some every day. Is it advisable, and what's in a call to comrade and we engage in that?
So me they tell comrade and say that was not necessary. That boku wash not necessary. Okay, you wash the picking 24 hours after I don't born. You can wash them if you want, but not so for put her inside the bathtub. You wipe and down. Then 3-4 times for week you can wash the baby, and then after you can wash the baby. And if it's soil, obviously, you get for wash him in waste and everything. So I know they say no wash him. They say wash him, but not wash him 2 times for day, 3 times for day. It's not necessary.
The program is still listening to now. Well, Bodi talk with the council from the Society for Radio Democracy 98.1 FM. You listen to Dr. Nelly Bell, President, Pediatric Association of Sierra Leone, and the HOD for Pediatrics, College of Medicine and Allied Health Sciences, Commerce, and also University of Saloon Teaching Hospital Complex. Today we topic na myth in newborn babies and the Pediatric Association of Sierra Leone and its upcoming conference. We still look at myths around picking them. We don't look at some of them. We have to look at more, but we go for short break. When we come, we continue the program where we talk. Where they come to you from the Society for Radio Democracy 98.1 FM. May they bring you this edition. Musa Kamala na minim.
No condition. The condition is permanent. Yeah. 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 Like we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. But no condition. The condition is permanent. Yeah. 'Cause no condition. The condition is permanent. Yeah. 'Cause no condition. The condition is permanent. Yeah. 'Cause no condition. The condition is permanent. Yeah.
This is Chibang's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation in this life. You've seen today, tomorrow is the promise. In a twinkle of an eye, your story might change. Be you black or condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Shout out to you, white priest. Why you came man of the moment? I salute you. Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent.
They love you, my dear sir.
The program now will Body Talk. It comes to you from the Society for Radio Democracy 98.1 FM. In case you just tune in, you can, we go open the phone line anytime from now. So you do call and make your contribution. You go ask Doc any questions we get for do with picking and the myths them who you get. Doc, we don't talk about some of them. What are some of them other myths them around picking with and just?
Yes. So we go stay with the rob.
Okay.
So you get one style where mama there, or mostly the granny or the auntie, then they rub then herbs na this part of an aid, say mole.
Yes.
Okay. So then call them fontanelle. Then they every baby get them. So it is not something special for specific babies then. All babies then get them. Why did they? Because the aid get for grow. You know, the aid get for grow, so you need space for like grow. Because if all the bone they all fix together, the aid not go able for grow again. So the brain get for grow, and then the aid get for grow for fits the brain. So that's area where they where non-bone not they what we call fontanelle. In normal, okay, fontanelle in they pulsate, okay. Nothing not do the baby. In normal. So you no need for put that thread.
Yes, most times they put the thread, especially when they picking the hiccup. They say the stopper. Is it that's the case?
No, picking and hiccup, it's normal. Okay, not so sick or anything. So so the reason being that thread or that herb, that green thing where then
they plaster na the aid.
It also contain bacteria them. We go infect the baby. The baby they move. You can put on there, put on a mouth, put on a eye. So it's not good. It's not necessary. Let's put it that way. It's not necessary. You know they cause great harm, but it's not necessary because it's not get for do. No, it's not get for help. You know the how the day now so you get for they say the baby grow. Say about 7 months it glock back because the head or longer than that safe because the head get for grow. Okay, so another rub. Another rub. Now the umbilical cord we call them. That's outside the baby being
connects to the mama.
Exactly, you know well. They safe, they can rub, then green things, then panam. Then they in worse. Because they're a great source of infection. Because then newborn babies then where they can get infection, a lot of the times they force the infection, they start. And then they go inside the body and then develop sepsis. So then they in dangerous. The one at the head, it's not good and it's not necessary. But the one at the umbilical cord, in dangerous. If you rub them green things then or any other rub any other thing other than we get what we call chlorhexidine working where then can rub na hospital. Okay, we get one substance, one liquid where then can they put spanner where they disinfect the cord. Okay, so then they okay, but anything else, in fact some countries then say don't stop that one day. Anything else, no rub panda baby in cord. Because it will cause infection, it will cause for leather picking they sick and get sepsis and they go na hospital.
What about a case beside in the draw the picking nose for make it straight?
Yes. Then they're not bad.
Okay.
Yes. So
you know, possible for change shape the nose.
No,
shape?
not at all. If na the mommy they do I tell you what thing will happen. The mommy, if you draw the pikin nose, it they develop that infection they where that pikin they get. And they show signs of that infection, and the mama not get for suffer from that infection. But guess what in the mommy in body they produce? They produce what we call antibodies against that infection day. And guess how that antibodies they come out from the mama? It go to the pikin through the breast milk. You understand the impulse? So you can do that. And in fact, some days they don't need for do that. Where if the pikin gets a infection, the mama can automatically gets that infection there and then build antibodies. Now that make breastfeeding, and then I go preach and say tomorrow, then you get for call me 1 whole hour when they talk about breastfeeding no more. Breastfeeding is very important, especially exclusive breastfeeding. Then at 6 months. Okay, so you draw the nose, you get it. Then if the mama do am, if the papa do am, obviously not go help.
Oh, so that mama for drum. How long they go draw the nose?
But the papa himself can do am. It's okay. The auntie, the uncle, the granny.
How
all
long they go
can
continue for
yes.
draw the nose?
No, so as long as there's an infection. So if you get snot, you know how for let snot left inside the baby nose. Really, okay. If you go to a side way, they're able to give you something where you go spray at the nose for let the infection come out of the nose. But ideally, no one for keep that snot there inside the pikin nose. It need for come out. Okay.
There is also this other drawway for make the pikin nose straight.
Yes.
If the nose open, is it possible for let the nose change shape?
No.
So how them born you now?
So nothing in medicine, nothing not 100% too. But no, that one day I don't know about that one day. Say that day they cause that one day.
The program now Bodi Talk, they come to you from the Society for Radio Democracy 98.1 FM. You listen to Dr. Nelly Bell, President Pediatric Association of Saloon, and also HOD for Pediatrics Commerce and the University of Saloon Teaching Hospital Complex. Today they look at myths and care about newborn picking them. Later inside the program, we go talk about the conference we didn't get forget, and they go tell we the dates them and what they would expect and how this go up in the area of newborn picking them. The program now Bodi Talk. Yourself when they listen can call on 077 981 981 077 981 981 and make your contribution inside the program Bodi Talk. Where they come to you from the Society for Radio Democracy 98.1 FM 77981 Call and make a contribution. You can call on the number same we say now WhatsApp. So if you do on WhatsApp, you can dial and call and ensure you get a very strong network before you call. 77981 what's not the myth where you get about newborn picking and what do you think say how things say then go help you or what you want ask the doctor na the program. With that we go for short music break. Where we come we continue with the studio guest. We look at other myths and also look at the conference we then get forget.
Daily courage. No condition.
The condition is permanent. Yeah.
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 Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Yeah.
'Cause no condition.
The program now Bodi Talk in the country from 98.1 FM. We'll get a caller on the line. You name outside the call from Bodi Talk.
I had a call from Allentown.
From Allentown. What do you want to ask about?
Doc make mention of this 6-month exclusive breastfeeding. But I want to ask how best can they try for CCA government in policies, they also align with that, because currently for civil servants, them we know they get 6 months leave as maternity leave. We only they get 3 months, 2 weeks. So if they are saying that to forget 6 months exclusive breastfeeding, but in government that one is not a permission for staying at host till 6 months after we don't deliver. So I don't know if we the civil servant or if we the public servant there, we also for benefits from that, or we are excluded. Interestingly, now that's I just want to ask.
Thank you very much for your contribution inside the program Well Body Talk. And we get another caller on the line. This is our friend from UK, Osfred. Yes, Osfred.
Yeah, thanks, Musa, and thanks to Dr. Bell. Now, Dr. Bell or Dr. Blell? La Bell or Blell?
Dr. Bell.
Oh, Bell. Okay, Dr. Bell. All right, because I have somebody Bell. Well, just a few things I want to say here. If they talk about something to do with the breast, but I don't know if they can advise parents them for take them pregnant woman them that calcium lactate for help them in terms of that blood pressure for avoid pre-eclampsia. That's one thing. Then the area we talk of that area for the Peking newborn, I just don't know how they can advise woman them back when they come in terms of delivery, and then the midwives them or the one they want doctors them how they will able for do the APCA score with a rapid 10-point assessment who they can do for let me baby them for know the skin, it reflects if they cry, I must day for know if it score more than 7. Then the other one. Then in terms of the NMC, I don't know whose relationship they don't build between the midwife and the doctors them and that NMC, the new laws they don't put out and they go along with them. That's the only thing today, and I don't know if anything they wouldn't record in terms of the areas and the provinces, them the way we women and they attend the postnatal clinic and antenatal clinic. I do know that they get records, but how effective the record they come towards the website who them introduced. Then the only thing. But thank you very much. Yeah, thank you.
Thank you very much for your contribution. The program Well Body Talk that Osfred and a regular caller on this program from the UK always to join the program Well Body Talk. We'll get another caller on the line. You name said call from Well Body Talk.
Hello.
Yes.
Good evening. How are you?
I do fine.
Radio D?
Yes, Radio D 98.1.
Hello, please. Thank you. Big thanks to the doctor. Very, very well grounded, explain well. A concern is from Britain anyway. About this myth. In our brain settings, we get one myth where they be always try when a child is born. You get them something well, and they say, like, Mama, be Jakatu or whatever, also. So they go Jakatu. I don't know how this, please.
Okay, fine. Thank you very much. And I think I go echo you question or you concern to Dr. Bell. He said whether the born picking, he get then ball in them pana, bomb in them. And the myth like that, Mama, be the eat Jakatu. And so you want to ask about that, you want clarification on that, if that in any way will lead to that. I think he gets few concerns them from Osfred and other people them around. He go respond to them.
Okay, yes. So I'll start with the first question about exclusive breastfeeding in the first 6 months of life and the civil service. Myself na civil servants and myself na kumbra. And myself go through that. And indeed, you get some side at the world where they give time off. Then go give sometimes 3 months off complete, and then 6 months, then half salary, 1 year, 3/4 salary removed, or just 1/4 normal left, and then you can continue forget maternity leave, now so we call them, after that without your salary, but then they hold your position for you. You get siding, other country the way they do that one day. But for we, Naya, so it is what it is, 3 months, and now we get for day maternity leave. So what can we do? exclusive breastfeeding include the fact that you can pump the milk and keep them. Okay? So if you're a civil servant, you're in an office, we get fridge and freezer. Okay? You can go work, so you dey left you picking, na house with somebody, then you dey go work, you dey pump the milk, you put on a freezer. You make sure, say, obviously, you wash your hands, IPC, very important. You wash your hands, you get a sterile container, all of those things are they take as given, okay? You pump the milk, you put on a freezer, then you can't go na house. That milk then you can use the next day for give the baby. Okay? It's not always, because not all man get fridge, okay?
Is it that you go cold to that extent that we go even like a block because some freezer?
Yeah, you can do that. Yes. It can go block as long as you're able for warm them up the next day.
You warm them up,
Yes.
so you no go give the picking the cold one.
No, of course not. You get for make it lukewarm.
I go
You
warm
get for warm them up.
Is it?
So you get warmers them, okay? And as a civil servant, I think say you go able to afford then warmer. Then you get specific warmer. They just they put her inside, warm up to the proper temperature, and then you do with that. But then, just like formula milk, where you give, you get for test the temperature of the formula milk where you don't mix and done. Now the same way you go test the breast milk after you don't warm them up for see if it's too hot or if it's too
You can
cold.
warm it inside warm water.
No, so you they put the
container.
flask.
Yes.
Yes, the milk there inside the flask. So you put the flask inside
Hot water.
hot water for let it cool.
You
for
check
let
the
it warm
temperature
up.
before you.
And then you check yes. Just
I mean-
like how you dey do for formula milk. No?
I mean, from my own experience as a journalist, and as somebody we don't they report on issues. I mean, when the GW Act been come, now one of the things them we them be suggest inside this bill,
Yes.
but it not been go through. I think them be remove them because they really be the push for 6 months maternal leave, but the MPs them and the advocates them not be seen that way, and they be remove them off from the bill. So maybe in days to come, proponents then go continue the campaign for CC. It actually happened because
Very important.
because the government policy they say now 6 months breastfeeding, and we get this 300. I think it get for be part of the campaign for the 300 days.
Yes.
Let them
It
move.
is.
Yes, it should be because they advocate for 3 months or 6 months breastfeeding, but you get a law where they ask you for
No,
for
but
just-
as I say, there are possibilities. There are possibilities. The American in less than 3 months safe. So there are possibilities and there are different laws. So we no go twist the arm of government in as much as me seven na kumbra, me seven na woman, I go prefer that.
Okay.
But it is very important for let we get that one day.
we don't want to go into advocacy today
Yes.
because if we go into advocacy, the debate was that
Mm.
if you give 6 months off to one, companies waiting to competitive marketing, then will reject woman day because you know say we born 6 months you get for go.
Exactly. Especially young women, them up and coming young women.
Yes.
We want to forget executive positions.
Yes,
and all of
because you
that.
cannot have an executive position and you go for 6 months. So this is not the debate from the other side that if you give
So-
woman 6 months, time get for
Yes.
come, nobody want to hire them for work
Yeah.
because then we
That's
think
the
say when you
risk.
born you go for 6 months
That's
again.
the risk, yes.
So that's another.
But it can be optional. It can be, as I say, na other side and the way, this hour train, you can do longer, but then they cut your salary.
So you respond to us, Fred, and the other one them. So
Yes.
we will.
So calcium
Can't
lactate
talk
for
about
pregnant,
in our
pregnant
conference.
Inc. talk a lot about pregnant women. Me there for picking them. But the NMC law, new laws, are not too conversant with that one. They down there, I go get for send them back to our owner MMC. I not too understand which laws they maybe they talk about. The new laws that we don't come.
Yeah.
And then the APGA score in health facilities. Yes. So that is one of the pre-conference activities that we will want to do for teach midwives and nurses the way they are their health facilities. Then they talk about the villages, the PHUs, but they focus first on Western area, urban and rural. Because don't find out say they need support in training in that area. Okay. So yes, a good number of them sabi do the APGA scores. Yes. But on the other hand, a good number of them not sabi. The one the way they deliver them babies them. So that is one of we mandates for teach and train about newborn care, where they include now newborn resuscitation and include APGA score. And then I think the other one are the well where they are the skin. Now the
Yes.
bumper mine, what they talk about? So when they rub bumper mine, it they cause them boiling, and it's very common. That salon, and I know, and somehow they know they relate bumper mine to that one day, but 100% of the time.
Jakato.
No. So basically, no. That myth they no, no hold waters. Okay, but that one then at the bumper mine, now they cause them boil and then at the picking their skin. So now that's what we don't talk about before.
So, time no good in our favor. If we want to discuss everything, we merely get like 14 more minutes. But in case you dey listen, or it's just the join we, you dey listen to Dr. Nelly Bell, President, Pediatric Association of Sierra Leone and HOD for Pediatrics Commerce and University of Sierra Leone Teaching Hospital Complex. We will talk about myths about around newborn picking them. You can call and ask any or raise concern or comments. You will respond to that. And Doc, when I get a conference where they come up, tell me something about this conference, when this conference will come and what they would expect for the.
Yes. So as I mentioned before, the Pediatric Association, we are 2 years. We're 2 years old. Okay, we're very young. Okay, and the past 2 years we they get conference every year. The first year, the Minister of Health, I launched the association. The second year, Vice President joined we for a talk about malnutrition. I think we've been kind of so safe and talk about malnutrition. And this year, we talk about newborn care. The theme is Healthy Start, Healthy Future, Strengthening Newborn Care in Sierra Leone. And then the symposium, when at the afternoon discussion, again for be on improving newborn survival during the 300 days of activism and beyond. So nobody's 300 days of activism, right? With the president's term, yes. So now that's the conference there about. So one for talk about newborn care in Sierra Leone and how we can improve them. So that means they bring all the stakeholders then together where they deal with newborn and talk to them so that we go all be on the same page, because especially the partners there, you get fractionated, all man they do in your own beats, all sign at the country. So I want to bring all of them together so that we'll be able to talk to them and we discuss, you do down there, you do that one day, you do down there, so that we don't duplicate, we don't go overlap, and we'll go all talk with the same voice and do the same training so that the babies then go survive in this country. So now that's
when are the conference again? And
the 29th of May this month.
So this now among just una safe no more.
No, we're in the process of sending out invitations. We don't send out invitations to the stakeholders them. So now amongst we and then amongst all partners, anybody will get anything for do with newborn care. We even invite the Interreligious Council, we invite community stakeholders them. They will all come together and sit down and talk about newborn care and how we go improve newborn care in a salon.
And the conference na Freetown?
Yes, na Freetown na Atlantic Lumley Hotel. You say we not send out invitation now. Yes.
In case somebody they listen now, want for be part of the conference, get an NGO where they run, we get for do speaking them, or he get interest in the topic matter. How we will be part?
Yes. So you can contact me. We obviously now are during Children's Hospital. So you can contact me now during. You can ask for Dr. Bell or Dr. Ba. Dr. Ba naina di Dr. Abubakar Ba naina di Secretary General for the association. And Dr. Onita Luke, the Vice President of the association. So you can ask for any of we, now Oladu in Children's Hospital. Then we go able for answer them and give them more information.
7798191 now the number where you go call and be part of the program Bodi Talk, where they come to you from the Society for Radio Democracy 98.1 FM. You can send in your text message or you call on the number 077 981 981. And if you just join we will talk to Dr. Nelly Bell, President, Pediatric Association of Sierra Leone and the HOD for Pediatrics Commerce and University of Sierra Leone Teaching Hospital Complex. And Doc, they round up the program now. For somebody where they listen to you now or they watch you live now Facebook, how the medication and treatment of newborn PPDM sound like na the country, especially na cottage way na or during Children's Hospital. We'll get a caller quick before we respond to that one. You name also the call from Bodi Talk.
Yeah, good afternoon.
Yes, good afternoon.
They are confronted to the call from Freetown.
Yeah, from Freetown. Your contribution?
Yes. Thank you, doctor, very much. I just listen, doctor, no more to talk. Now, something about the remember. From forefathers in time, bumper mine. Then I just wait till the bomb begin, and they open for me go clean. We everybody know about. So I just wonder now where the stable bumper mine not sign for open baby. And also for me, no go find no more for open baby. I just for convince we for most of our work about baby. You know, just for easy. I'm not interested in that. I ask them more. I'm bumper mine for the open.
Okay, plenty. Thank you for yes. It make docs if they laugh.
Indeed.
Yes, so doc.
Indeed. So it's engraved, embedded in the same thing like this thing at the head and at the cord. You know, it's dangerous. So we in at the hospital and you.
We'll get another caller
Okay.
quick. Yes, you never said call from Bodi talk.
Yes, good evening.
Yes, good evening.
Yes, Mina Kadi, I call from Quito.
Yes, Kadi, your
Well,
contribution.
I joined the program late, but I listen where doctor talk. You know, concern at the time where they talk about breastfeeding. Because like we saw with the work. Now one way they say for these 6 months exclusive. Because 3 months your office don't call you back for car work. And sometimes then if you don't manage the baby water fine, they get infected. That way they say for put on a fridge, go preserver. Now, civil serving, not all office get fridge. Sometimes your room not get fridge. You don't forget to put another pot in room. You remember the safety of your baby in food. These are food we get for to go inside small baby in the leg. So sometimes then it's hard. So even give that 6 months exclusive breastfeeding. It is very hard for we where they work. Because you got to run to go in the office and you the whole day. At times, if you caregiver, we're going to watch you begin. So I don't know. Sometimes their program they also go for make. Maybe we ask Mama then they really concern how for extending this and this for we. Because it is very difficult for taking of that body water where you know go get contamination for these small picking. So that we concern now and then. I don't know if where they were then go for looking into that one day. We probably can go extend for we so that they go for help with the comrade.
Okay, thank you very much for your contribution. I think the concerns them boku, but the concerns are in the direct and to doc. They want make you policy maker today. You never said call from Bodi talk.
Yes, please. I'm Memuna again from Allentown.
Memuna from Allentown, yes.
Yes, so early this year, we be really say milk they don't dey na the pet now way next to the call. And unfortunately, maybe me top one per day milk and day. Where they under the after meal ground, where I check the dates and everything I see on TikTok, now in match with them. But I not see any press release. Maybe I not see them. Maybe they pull them, I not see them. But to me, I not see any press release, you know, on the side of government or on the side of the association for Fenway for try for remove some of them milk and then at the market. Because once the picking take them, that whole day they torment. Now that year they get and they throw. So I don't know what thing they can do in that aspect. We are in something don't enter at the market. So not good for the young baby then. How for we call them.
Thank you very much. Yep.
Okay, yes. So I can talk the bumper mine. I agree. Now something where don't people them don't they do for many years. So they talk from the we experience. Okay, now inside the hospital and where they see them babies they suffer. So maybe they rub bumper mine per you and you're okay, or maybe not. We don't know. But the one where they see in the hospital where they come with the skin infection, with the most 100% of them don't rub bumper mine. Now that make the pikin develop, and that bumper mine they not sterile, they not clean, and that make the baby they develop skin infection. Okay, so that's a lot of things. Then they will go they do for thousands of years, but then we find out say, well, why would they do them? Really, So we need for wash the baby. No, we don't need for wash and that often. And if we not wash and that often, the baby skin not go dry, and then we not go need for rub bumper mine param, and then also the baby not go cold if you wash and too much.
Okay.
So yes, so then the breastfeeding, the policy, it's difficult. I agree, and I agree. Say you get for make sure say a sterile environment or clean environment you fridge you for put that breast milk. Then if it's not guaranteed, if there's nothing else you can do about it, then you need to find other means. Okay, but the fact remains that the baby go benefit more from breast milk, because there are a whole lot of positives the way they get with the picking, up to prevention of hypertension and diabetes and all of those things. There's so many, as I say, need for call me another 1 hour for low talk about breastfeeding and breast milk. So it important. But if it's not possible, then it's not possible. So don't stress yourself out because of it. Just try for fend ways, because some instances they go fend the boss man or the boss woman. Say, look, now you fridge now the cleanest in this place. Do ya Dr. Bell said on radio, so for do 6 months exclusive breastfeeding, I go able pump and left me milk in your fridge. Things like this. Go out of the box.
Like the homes
and then you
wear Sanegi lights, so how that possible?
No, in those some of the homes for no. So what you they pump today, now you they give tomorrow. So you don't left at the fridge, and then there are possibilities. But if it's difficult, then don't stress yourself. Mama not for stressing yourself at all for anything. Okay? Just make sure say you try as much as you can for give you baby the best, which is the breast milk. But if you cannot, hey, it's okay. Do what you're able for, do as much as you're able for do, and then you get other means of caring for you baby. Yeah? So I know I'll let you stress about that one day.
Okay, Doc, plenty thank you for joining me in this edition of the program. I'm not going to pick any further calls again, and because of time, we favor. Plenty thank you, Doc, we join me in this edition of the program. Like you say, you go wish for the camera radio. We get a special program, Naya. We get for do with 300 days activism.
Okay.
We now Monday, it come for 5 to 6 o'clock in the evening again. You get for do it just well body and the 300 days activism. We in a course of the Ministry of Health. We support the democracy for bring that program for raise awareness about health. Plenty thank you for joining. I want to wish you all the best in una conference we una get.
Thank you.
I really say they invite everybody. I know I really invite media anyway.
No, they're definitely there. They're always there. For sure, it's standard.
Okay. Thank you, Dr. Nelly Bell, President, Pediatric Association of Sierra Leone, and HOD for Pediatrics Commerce and University of Salone Teaching Hospital Complex. For we join me in today's edition of the program Well Body Talk. Today we talk about myth and newborn care, and also talk about the Pediatric Association of Sierra Leone upcoming conference we didn't get forget. Plenty thank you to we partners them. We now University of Salone Teaching Hospital Complex. We don't give we experts them inside this program always for kind raise awareness but in them. We the Ambog Well Body. Today we look at newborn. Don't forget you will listen today. Take note of all those we discuss. Next week he gets prize for win. As always, we get 50,000 Leon stop up who they give to people with the answer to the quiz them on what will they ask about what will be happen at the the last program, and that's now the University of Salone Teaching Hospital Complex. They support that also. If you listen this program and you care about well body, you want for help in that, you go able support for make we give more prize to people, so we get more people involved in the program and listen to them. Now this edition of the program, Well Body Talk, go left you. Plenty thank you to me technical man on duty, Madi Cry, and also plenty thank you to Mary Kamara Bangura for in technical support. And we will bring you this edition of the program. Musa Kamara Naminim. Plenty thank you to my producer. We help put this program together. So till then, Musa Kamara say bye bye.